I'm on call, I guess, hoping to get some clinical hours in. One of the best things about the hospital, when people suffer, I benefit. I would say it was enjoyable. I got my bags packed for clinicals, my little health assessment, 8 pages of stuff I got to fill out on a client. And then you guys know one of the best things about the hospital, the ice. You know, if you've been in the hospital, they got the Sonic ice. And I've learned I can make coffee concentrate. This is cream, hot chocolate mix, and Aldi's instant coffee, which I really like. I'm not a huge instant coffee fan, but I like this stuff. So it's like concentrate, because I got a couple scoops of instant coffee granules, some heavy whipping cream, and some hot cocoa mix. And then I just fill this up with ice all the way, and it makes an awesome iced coffee. So it's like my favorite part of clinicals, I think. But I can't go to clinicals to get ice. The nurse just called me and said, so we have 2 patients, and they're both getting discharged. So there's nothing here for you. She said she would call me if they got an admission, which is good. They have to have someone inpatient for me to go there because I have to do a head-to-toe assessment report paper on whoever comes in. So they have to give me someone. I could spend time in the ER, I think, as long they still haven't checked with the supervisor lady. It sounds like as long as I don't do anything in there and I'm just observing, if it's slow on the main floor, I can go to the ER. But with no patients on the main floor, I really shouldn't try to come in today. So this is reassuring me. If I'm going to work at a hospital, buddy, it's going to be Pana, because I'm all about a low caseload. But I don't really think med surg is for me. No. I was watching the Elsevier clinical skills videos yesterday on private part exams. And I'm just like, it's not for me. There's nothing wrong with being a doctor and dealing with wounds, or being a nurse and dealing with wounds. Like, there's nothing wrong with it at all, guys. Hats off to them. It's not that it's beneath me. It's just, it's not something I think I would ever get very comfortable with. We'll see. You know, maybe. I've seen some stuff in clinicals, and it has not been as I thought it would be. But really, I don't think I'm a wound person. My hope of I'm looking at my veggies at the same time. My hope of feeling brave enough to work at the ER, because it's interesting and fascinating, is very quickly fading. I don't think it's meant for me. I'm really looking forward to the mental health rotation if I can get into the swanky drug rehab facility, which I've yet to hear if that's going to happen or not. It's about 20 minutes away from me, I think. I really want to go there. The HR person said they would reach out to someone else, like the program manager. I know that the school is reaching out to them, but I haven't heard if I can work there or not. So I'm really hoping. I think I deal with craziness and mental breakdowns a lot better than vomit and blood and poop and bodily fluids. So, and probably people that are really good with vomit, blood, and poop and bodily fluids aren't quite as good with the mental breakdowns. I don't know. We'll see. Maybe I'm not good at mental breakdowns either. We'll see. But yeah, that's my day today. I'm on call, I guess, hoping to get some clinical hours in, and hoping if they do get one patient, that it's someone that is interesting and not on too many meds and likes to talk, because yeah, that's a lot of information I have to get on one person.
I just thought it was funny that she said that she hoped people go to the hospital today.
I mean, just one.
She wants people to be sick or injured.
Just one person.
Just one person.
One person for the sake of learning. You know, I thank people. I send people pictures of nursing questions, and I thank them for helping me through nursing school. Did you know that, buddy?
No.
Yeah, I sent our friend a picture of what would you recognize as a risk factor for DVT, deep vein thrombosis, or like a blood clot in the leg. And one of them was birth control. And I knew that because one of our friends had to go off birth control because of DVT. And I sent her a picture, and I just said, I want to thank you for your suffering that I've benefited from. And I also sent that to my mom, I think, for diabetes and what does steroids do to your blood sugar level. I'm like, thank you, Mom, for suffering. Your suffering benefited my education or something. I don't know how I worded it, a little more eloquently. Something like, I just want to let you know that my education was benefited by your suffering. I know and will never forget that prednisone and steroids can cause an increase in blood sugar, because her blood sugar was like through the roof when she was in the hospital with COVID. So yeah, when people suffer, I benefit.
That sounds horrible.
I'll let you guys know if someone's suffering and I get to go in and benefit from it. But right now I'm going to finish fixing my zucchini, which is delicious. I just tasted it. This is my breakfast this morning. My rules right now for eating are 8-hour eating window. But if I'm hungry outside of my 8-hour eating window, I can eat a piece of fruit or a vegetable. Not like potatoes au gratin, but a vegetable. So I might be pushing it a little bit with this one because I put some butter in it. But guys, I don't think anyone got fat off eating zucchini. Change of plans. Someone's sick. So actually, I think I'm going to start clinicals on time. It's 9:30 right now. So hopefully I get there in time for the admission. Gonna speed things up. So one bad thing about just waiting on call for them to come in is that I live about 15 minutes from the hospital, but I don't know when their admission is. And admission time, I've only seen one admission onto the main floor, but it took quite a while, and you learn a lot during admission. So it would be really helpful to be there as soon as admission starts. I think it's possible that I'll get there in time, because she just called me like, I don't know, 3 minutes ago, and I'm already in the car headed there. And if they're being admitted like from the ER, maybe it'll take them a little bit to finish up something down at the ER before they send them up or something. Anyways, my hope is that I get there before they admit this person. I don't know what the chances of that are. I will say, if I'm gonna work at a hospital, I want it to be Pana. They just get to give so much time to their clients, to their patients, and that's nice. Like, that's some really makes you feel good when you can give your patient all the time they need. And I think that's possible at Pana. And I don't think that's possible always in regular hospitals normally. I mean, I was telling our home nurse the other day, she's kind of new, and we were talking about when Raylan had COVID, and Raylan went from no symptoms to major problems keeping her oxygen up, like just overnight. She was fine, we went to bed, and then like a couple hours later she was not fine, and I thought we were gonna have to go to the hospital because I didn't know if what we had at home was enough. And what we have at home is albuterol, which is a bronchodilator, and then I don't think we had steroids at the time at home. Pretty sure we hadn't started the Pulmicort, which is a steroid. And we had Shaker Vest, which helps loosen mucus, and we had Cough Assist, which helps her, expand her lungs, take deep breaths, and forcefully breathe out, cough out. It's like a fake cough. And we had oxygen, PRN, via nasal cannula. We did albuterol, Shaker Vest, Cough Assist every 4 hours around the clock for several days. And that takes, when you're tired, which we were tired, that takes about 45 minutes to do the nebulizer, the Shaker Vest, the Cough Assist, and you're doing other things at the same time. You're doing med, you're gently turning her, you're listening to lung sounds a little bit, seeing what side to layer on based on her lung sounds I would do. That kept her out of the hospital. We could have gone to the hospital, and I'm pretty sure they would have admitted her with as much help as she was needing. But, okay, so long story short, if she went to the hospital, I don't think she would have got as good a care as she got at home, because they can't guarantee they can get to her every 4 hours for shaker vest, cough assist, nebulizer. I mean, they do approximately, but there's leeway. And when you have a ton of patients, sometimes your person gets their treatment an hour late, which isn't a huge deal. But again, at home, if we could stay home, which we were able to, I could do it every 4 hours. Now, had Raylan got sicker, that would have meant that she needed BiPAP, I'm pretty sure. And at Children's, if you're on BiPAP, you are in the PICU, which PICU, you only have two patients for every one nurse. So if she was in the PICU, she would get better care than we could give her at home. Because honestly, one nurse plus me, plus all that equipment, that's way better care than we can give at home. But on a main floor of the hospital, if all she was getting was a bronchodilator, shaker vest, cough assist, and then maybe a steroid on top of it, probably home's better. So yeah, but Pana, man, one patient for, there should be 2 RNs there. I think there will be 2 RNs, and you got a student nurse that, you know, I don't know much, but I know how to go grab stuff for them. I know how to get them a warm blanket if they want a warm blanket. Probably slow the nurses down more than I help them. I try to do things like grab things they need so that I'm not slowing them down as much when they're having to do other things slower as they show me. But I'll let you know about my one patient after I get there. Here we are, guys. In a hospital. I just park in the front. I don't know where employees are supposed to park. I tried parking in the back once where I thought employees were supposed to park, and I couldn't get in there. Maybe I could have if I had a badge, but it doesn't look like there's any shortage of parking here, so I don't think they care. Here I go.
8 hours later.
Driving home. Today was very much CNA day. Did a lot of helping clean 2 patients that we had up, helping feed one of them. I removed a catheter. That's a lot easier than placing one, let me tell you. So originally they weren't even going to have me come in because they were like, we don't have any patients. We have 2 that are getting discharged. Well, when I got there, those 2 were both still there, but one was like on her way out the door. I didn't even see her. The other one they thought was gonna go home at noon. They didn't finally come get him until, I don't know, I want to say like 3:30, and he set the bed alarm off a lot, which meant we were in and out of his room a lot. He very much was like super confused. Very nice man though, like very easy to work with, but just really confused. And then the guy that came in, he had COPD and congestive heart failure and just had some bad sounding lungs, so he was there for some antibiotics and to keep monitored observation. I think that's what they said, observation. And they did some labs, but everything, like the sputum lab, they're waiting for that to come back. The urine lab looked good. Those general labs that they did in the ER, several of those looked out of whack. Kind of boring stuff. I don't really think med surg is for me, but I think I already said this. If I were to do med surg, I'd want to be at Pana Hospital. And the food, I had tater tot casserole today, guys. Saturday special is tater tot casserole. I haven't had this in like 15 years. That was $1.66. The prices in the cafeteria are amazing. And that was pretty good tater tot casserole. Can't work somewhere just for the food. Because honestly, you don't have a lot of time necessarily to get a lunch and eat, depending on what's going on and stuff. One thing that I will say is, yeah, they have smaller patient censuses, but they are doing things that nurses aren't doing as much of in a regular hospital. Like there is no CNA on the floor, so that patient that needed fed and he was constantly setting the bed alarm off, I mean, that was the RN's taking care of him. And the RN even said yesterday she shaved his face for him. That's something I was told, oh, when you're an RN, you'll never do that. Well, the RNs at Pana Hospital do because the census is low enough and there's no CNAs, they have time to provide that level of care. Labs, like we run this stuff down to labs. Pharmacy, there's no pharmacist on duty on a Saturday, at least not in the building. So when the new patient was admitted and they needed some meds, they go into the pharmacy, which that was kind of cool. I saw all the meds that they have in Pana in their pharmacy. And these really cool scientific labby looking things. It looked like maybe hoods. I don't know what the words would be for it. There were these big gloves that you could put your hands in the gloves to work under these glass hoods. I'm guessing it was for mixing medicines in a sterile environment. I don't know exactly what that was about. But I saw those in the pharmacy. But yeah, so there's not a pharmacist there on Saturday. So they would sign in and pull out the med they needed and then write something down on a paper. I don't know. And then they would leave that box that they pulled with the meds in it out for the pharmacist, because when the pharmacist comes back on Monday, I guess they have to do something before those boxes go back on the shelf, or those little bins with the meds go back on the shelf. But I helped pull meds, and that's another thing. At the big hospital, the nurse isn't doing that. So they have less patients, but they also do more things than nurses at bigger hospitals do. They say they do more things, they also do less things, like if someone's super ill, they don't stay at Pana, they get shipped off to a bigger hospital. Oh, and they deal with outpatient too. So there's people that come in just for outpatient procedures up to the floor. So that's a responsibility that's different than normal med surg. Like today, they had someone come in for a vancomycin drip or antibiotic given via IV, and they had a midline IV, what is it called? I should know this, but they had like a midline IV something placement thing, and they would come in every day for their vancomycin, but he got his labs and his vancomycin was high, so actually they sent him home. They let him eat his dinner first. He comes in and he gets vitals, and I guess they draw labs before they send him up to us, because I didn't catch him drawing labs. Maybe a nurse did it when I was in a different room with someone else, but then they're like, oh, his vancomycin levels are high, so after he finished his meal, he went home, and he'll come back tomorrow and they'll recheck his labs again. But so yeah, they deal with outpatient people. They do what the CNAs normally do. They do some of what the pharmacist normally does. We run things down to lab because I don't have the fancy little, like the bank drive-through things that go like at Children's Hospital. I know they get things from the pharmacy and just shoots up in these little capsule things, and they shoot stuff down to the pharmacy in these little capsule things. We walk things down to the lab. That's it, I guess. But there are some things, that I don't think RNs at big hospitals do as much of those things. But still, it is definitely, it's got to be slower paced than a normal large hospital. And yet still, I think it's probably not up my alley. If I could do what I did today, I would be thrilled. Like, if working at Pana Hospital meant doing what I did today, which was being very helpful in giving some meds, I could do that. I'm fine with that. But all the stuff they're responsible for, like I'm just helping. I'm not responsible for anything. All the stuff they're responsible for on that floor and knowing and I don't know. Like I said, I'm just the helper. So I just think they have a very hard job. Very hard job. I don't think I could do it. Although I think this is I think Home health is something I would consider doing. Case management is something I would consider doing. Mental health is something I would consider doing, that I think are all more up my alley. And I do think the stuff I'm learning at Pana will help me do better if I get a home health job, besides Raylan. I do think the stuff I'm watching them do at Pana with charting, I mean, some of that would carry over into mental health, working at a facility, charting. I don't think I'm learning case management stuff here. I think I learned case management stuff, honestly, by dealing with Raylan stuff and all the phone calls I make on her behalf. But yeah, I'm learning skills that are helpful, I think. Getting to practice listening to lung sounds, finding pulses, taking blood pressure, listening to heart, all that stuff. So yeah, that was my day. Cheap tater tot casserole, wiping butts, helping with our fall risk guy that wanted to get out of bed constantly, didn't really understand where he was. It was a fun day. Fun day as a helper. If I was the nurse, the real nurse there, incredibly stressful to me, I think that would have left me incredibly stressed out. But just being the one that helps and learns, it was not stressful at all. I would say it was enjoyable. So, yep, that's my day. And I'll do it all again Friday. So I have almost a week before I go back again for clinicals. I have two more clinical shifts this term. Friday next week, and then Monday is just a 4.5 hour, unless I get my shift Friday shortened some. Monday is my makeup hours, because I had to go home early one day just because they ran out of patients. So the Monday after next is my at least 4.5 hours, maybe more if next Friday's gets cut short. But I think they're trying to see if it gets real slow, if I can just go down and observe in the ER, which I think there's always a lot to see in the ER. But my preceptor isn't down there, so the thing is, I wouldn't be able to do anything. I'm not supposed to do things unless she's watching over me. So, but I feel like I can learn a lot just by observing the stuff, to be honest. Yep. All right. So, and I'm almost home. Promised the kids I'd get dinner started for them. Well, they're starting it. I told them wash the potatoes, and then I'll cut up. We're gonna have kielbasa, potato, veggies, sheet pan meal.